Hello everyone, welcome to my channel The Tooth Fairy, and our today's topic is Treacher colon syndrome or Mandibulofacial dysostosis or Franceschetti-Zollern-Klein syndrome. So Franceschetti and Klein, they describe the same condition on their own observation and called it as mandibulofacial dysostosis. Mandibulofacial dysostosis itself tells us about the clinical features of the disease. That means mandibulo, there is a problem in mandible, facial, problem in face, dysostosis, that is development of bone, like problem in ossification of bone. So there are defects in the structures which are derived from the first and second branchial arch. Okay, so these are the branchial arches, like first, second, third and fourth. Okay, and on this outer side, 1, 2, 3, 4, these are pharyngeal grooves or pharyngeal clefts, and on the inner side these are pharyngeal pouches. So this pharyngeal cleft is originated from the ectodermal cell, inner one, that is pharyngeal pouch, from endodermal cells, and the pharyngeal arches, these are derived from the mesodermal cells. Okay, and this is A1, जहाँ पे A लिखा हुआ है, that is tuberculum lateral, and B is tuberculum impar, and the C is foramen cecum. So foramen cecum एक स्ट्रक्चर टंग में भी होता है, तो ये ध्यान रखना. सो हमारे पास यहाँ फर्स्ट, सेकेंड, थर्ड, फोर्थ pharyngeal arch है. देयर इज सिक्स्थ arch also, फिफ्थ इज मिसिंग इन ह्यूमंस. एंड तो फर्स्ट और सेकेंड आर्च का नाम क्या होता है? जो फर्स्ट है दैट इज मैंडिबुलर आर्च, and the second one is hyoid arch. So whatever structures are derived from these arches, उनमें problem होगी. Basically there is a mutation in gene TCOF1. The disease name is Treacher colon Franceschetti also. So यहाँ से हमें जीन याद हो जाएगा. इस जीन में प्रॉब्लम, ये क्रोमोसोम 5 पे होता है, एंड इस जीन में प्रॉब्लम क्या आती है? जो न्यूरल क्रेस्ट सेल्स हैं that have been sent to developing craniofacial complex, their number decreases. So there is decreased number of neural crest cells which are going to develop the craniofacial complex. So some structures are missing. Okay, basically neural crest cells, they form cartilage, bone, connective tissue, pigments and peripheral nervous system and other cells. Okay, so ये कम होते हैं neural crest cells, so this few structures are missing. Also there is autosomal dominant pattern. Autosomal dominant pattern हमें पता है that if even a one gene is mutated, so disease will be expressed in the progeny. Also there is association with increased paternal age. Same we read in Apert syndrome in last lecture. So there is a mutation in gene TCOF1, न्यूरल क्रेस्ट सेल्स कम जा रहे हैं, तो देर इज द अंडर डेवलपिंग क्रेनियोफेशियल कॉम्प्लेक्स. ओके, नाउ सिवियरिटी ऑफ क्लिनिकल फीचर्स इज ग्रेटर इन सबसिक्वेंट जनरेशन ऑफ सेम फैमिली. सो इट रन्स इन द फैमिली, वी ऑलरेडी नो. तो जैसे जैसे जनरेशन पास ऑन होती रहेगी, जैसे जैसे जनरेशन में पास ऑन होता रहेगा ये, तो सिवियरिटी भी क्लिनिकल फीचर्स की बढ़ती रहेगी. नेक्स्ट मेन क्लिनिकल फीचर इज इट्स bird or fish like face. Bird or fish like face. Then if we see this kid, तो हमें यहाँ पे कुछ फीचर्स दिख जाते हैं. हेड हमें नॉर्मल लग रहा है, तो इसमें क्रेनियल वॉल्ट इज नॉर्मल. ऑल्सो यहाँ पे हम अगर आईज देखते हैं, तो आईज में कोलोबोमा होता है. कोलोबोमा इज like there is an irregularity, there is discontinuation of the lower eyelid. तो एक जगह पे eyelid missing होगी lower side पे, ठीक है. and medial to this missing eyelid, like यहाँ पे missing है ये, ठीक है. मीडियन टू दिस मिसिंग आईलिड द लैशेज विल ऑल्सो बी मिसिंग, तो यहाँ पे लैशेज भी नहीं होंगी. ओके, मीडियल टू द कोलोबोमा देर विल बी absence of lashes. Okay, also if you see lateral palpebral fissure, this is down slanting, this is called as anti-mongoloid features. ठीक है, मंगोलियंस में अप होता है, अप स्लैंटिंग ऑफ द पैल्पेब्रल फिशर्स, बट इसमें डाउन स्लैंटिंग है. अप स्लैंटिंग हमारी होती है डाउन सिंड्रोम में. And then we can see the maxilla and zygomatic bones, they all are underdeveloped. Also we can see there is a abnormal pinna, and also in few children ear tags will be seen. Okay, in few people ear tags can also be seen. And the mandible is retruded, the chin is retruded. So now these are the clinical features. So head, we told cranial vault is normal. Eyes, there is hypertelorism. Okay, the distance between the two pupil is more, and downward slanting of palpebral fissure, we already saw that. Coloboma on lower eyelid, that is discontinuation of eyelid and deficiency of eyelashes medial to wherever the coloboma is present. Now next is maxilla. So there is hypoplasia of facial bones, lower number of cells of facial bones, and there is hair growth in tongue shaped process extending toward cheeks. तो यहाँ पे हमारे हेयर ग्रोथ हो सकती है टूवर्ड्स चीक, टंग लाइक प्रोजेक्शन होगी जिसमें देर विल बी हेयर ग्रोथ, टंग शेप प्रोसेस होगा. देन पैरोटिड ग्लैंड में भी हाइपोप्लास्टिक और टोटली एब्सेंट. यहीं चीक्स में पैरोटिड ग्लैंड यहाँ पे प्रेजेंट है, तो ये भी एब्सेंट हो सकता है बिकॉज हमारा मिड फेस इज हाइपोप्लास्टिक. And then there can be facial clefting. Facial clefting is due to lack of fusion of maxillary and mandibular process. So there will be the macrostomia. Okay, large mouth, because there is a failure of fusion of maxillary and mandibular process. Okay, next is ears. Ears में pinne can be deformed, extra ear tags, if these are extra ear tags. Okay, ये भी हो सकता है इनमें. And then ossical defects and absence of auditory canal, hearing loss हो सकता है. बाकी malformation in external middle internal है, ये सब problems आ सकती है. Then mouth, we already read this, macrostomia. And cleft lip भी हो सकता है with or without cleft palate. Teeth of upper jaw, they are normally not affected. Okay, there can be abnormal tongue position, the tongue position can be abnormal, so there can be difficulty in like breathing, you know. So this is the discontinuity of the eyelid. Okay, coloboma. These are the ear tags. Next is choanal atresia हो सकता है. Atresia is abnormal narrowing, and choana is that opening between nasal cavity and nasopharynx. Choana is also called as internal nares. Nostrils को हम external nares बोलते हैं. So the opening is narrowed down. So this is choanal atresia. Larynx and trachea are also narrowed down. So there can be difficulty in breathing like in an infant. So we need to do tracheostomy that time. ठीक है. तो paranasal sinuses are also underdeveloped because everything like in midface is underdeveloped. So all the bones and everything is underdeveloped. Mandible is underdeveloped. Retruded chin है हमारे पास, retruded chin. Then hypoplasia of condylar and coronoid process. Condylar and coronoid process of mandible. This is condylar, this is coronoid process of mandible. These are also hypoplastic. बाकी radiographic findings are like zygomatic bones, they are grossly and symmetrically underdeveloped. There can be absence of palatine bones, and rest radiographic findings we already read in these clinical features. And so now the treatment. So treatment क्या होगा? एक तो cosmetic surgery for whatever improvement is required in the clinical appearance. Okay, we have to do facial reconstructions also for ear, eyes, zygoma, mandible. Okay, orthodontic, orthognathic surgery is also needed. Otherwise, without treatment also prognosis is good and patient lives normal lifespan. So, And differential diagnosis, there is other syndrome called golden hair syndrome or hemifacial microsomia or oculovertebral dysplasia. Okay, this is differential diagnosis of mandibulofacial dysostosis, but this is unilateral. Okay, and it is also related to abnormality in vascular supply of head. यहाँ पे this is the golden hair syndrome, and this is unilateral. Okay, so thank you. If you understood the topic, please hit the like button and subscribe to my channel. Thank you.